Hello, my name is Ali Wilson. I'm the Senior Responsible Officer for the Regional Back Pain Project. That role means that I have to ensure that the project runs to time, runs within budget and actually delivers the outcomes that it's meant to do. In my day job, I'm actually the Chief Officer for Darlington CCG and Hartlepool and Stockton-on-Tees CCG. So did the project actually achieve all that we hoped that it would achieve? Well, this has been a very ambitious project, which actually really has two key elements to it. One is to improve the care and treatment of our patients and ensure that we can reduce levels of disability and give people a much better experience of quite a very debilitating condition. And the other has been an experiment, if you like, in working out how we can implement a change of this nature across a very big geographical area. So large-scale change, and this is something that, of course, we're all trying to achieve at the moment. So many of the things have been achieved. We've got still some evaluation to complete, so a further 6 months of some of the more rigorous qualitative and quantitative evaluation in terms of outcomes. But I'd like to give you a few examples of some of the things that I think that we have achieved. One of the things is that we've got a group of people fully enthusiastic who've been working hard to deliver a project, which has been quite an exciting piece of work to do. Many of the things have been hard to do. It's been hard to work collaboratively entirely with 11 different CCGs, but we did achieve an agreement that we would take this project forward, had an agreed MOU, and we have been working through bringing on board different CCGs as we've gone forward. We haven't achieved that with everybody quite just yet, but many of these CCGs are now implementing our new pathway. And that actually means that we have consistency for patients. It means that we have a pathway that people will experience the same kind of care wherever they go in our region. And that's really quite important, that we reduce the level of variation that we've been experiencing before. Clinicians are really pleased that we have got a clear pathway now. And as part of the project, much of the work we've done in setting this up is to educate and train some of the clinicians who've been working with patients to deliver the evidence-based care that we know that we should be doing. And these include many from physiotherapists to GPs to other clinicians in the acute sector, all of which have been fully trained in this new way of working and are now able to feel confident that they can offer good quality research-based care. So we've also, I think, managed to deliver a project at scale. We have set up and managed a number of different real challenges through that process, including some of the electronic information that we need to gather. We've had some mechanisms to try and put that in place, which has been quite a challenge, but we've managed to get through that too. That allows us to really ensure that we can evaluate the work we've done and we can monitor the outcomes from our patients. We've managed to put that in place. We've had a really successful communication and engagement process with our public and with the patients that we're working with. We've had some excellent sort of Twitter feeds and feedback from patients who have been learning to self-manage and self-care, who've been really committed to working through the pathway with the clinicians, supporting them to improve how they can manage this very debilitating condition. And we've also managed to set up a CPPP arrangement, which is a new way of delivering education and care and psychological help as well to patients who need to understand their condition, who need to know how they can deal with it and how they can improve their self-management of their condition so that they can continue with their daily life. They can go to work, they can do all of the things that they've always wanted to do and always have been doing, and are not ending up in a very chronically disabled condition. And we've had some excellent feedback from that process in terms of experience, in terms of outcomes. But some of the more detailed evaluation and outcomes will be coming soon, so that's another 6 months. So all in all, I think that we've achieved much of what we set out to do. Probably learned a heck of a lot more as well in terms of how you run a project of this nature, and looking forward eagerly to seeing the outcomes in terms of the final evaluation in 6 months' time. So whilst this project has very much been about improving experience and outcomes for patients, there is another element of this too. That's about not using resources that we really don't need to use. That's bad for patients too, you know, doing MRIs that are actually not really required or can offer no benefit, undertaking, for example, facet joint injections that actually will not deliver any benefit, has the potential to harm patients as well. And in fact, by cutting out some of those things, that means that we can streamline the pathway, we could get patients through the system much more quickly, so they have access more quickly to the right people. They're triaged and they're directed to the right place to go first time, so they get the right treatment first time and don't spend these many weeks having treatment that has no impact and no effect, becoming more and more disillusioned. And of course the other good benefit about that is that actually reduces cost, so we can actually apply that resource to where it really needs to be applied. So what do I think are the enablers to being able to deliver a project of this nature? Well, I guess firstly, if you're going to be working across more than one organisation, it's really important to spend some time up front talking to colleagues and about what it is that we are trying to achieve, and to ensure that everybody feels comfortable with the work that needs to happen to take that forward. One of the things that we did discover through the course of the project was that you know, we're working in real time. People have contracts, they already have arrangements in place with providers, and actually they take some time to renegotiate, even in some cases to re-procure. So you can't necessarily rush this job. The other thing, I guess, is that there's a lot of cultural change to happen, new ways of working for clinicians, etc. So there's training to happen too. So time in preparation is one of the key enablers really, in terms of ensuring everybody understands what's to be done, fully trained in what they need to do, and actually we begin to understand what cultural barriers that there may be to implementing a change of this nature, and spending some time working with them. Another one of the enablers, I think, is really to have a really strong governance arrangement. So we ran this as a project. We were fortunate enough to get some support for the pilot work through our Academic Health Science Network, and then following that work from the Health Foundation. But actually, whatever it is that we're doing in terms of implementing something which ends up being a fairly complex piece of work, it's very important to have good project management. So good governance, good project management, ways in which you know how to escalate, making sure that you've got really good engagement from the clinicians who work across the pathway, whether it be the therapists, the GP or consultant clinicians, because they're the people who can eliminate barriers. They're the people who can convince the people who are perhaps a bit more sceptical and are not sure they want to change. They can step in when we need to escalate, when things become difficult. So I guess those are probably the key enablers to making a project like this work. So what didn't work out in the way that we planned it, because any project, again, of a complex nature like this is going to have its pitfalls and its difficulties and its challenges. I guess the first one is that it took longer to set up than we expected. We got agreement from all of our colleagues, CCGs, to take this forward. But because of individual pressures in different CCGs and different priorities, our rollout programme didn't work quite as quickly and as effectively as we hoped it would. I think the learning from something like that is, again, around how we plan, how we expect there to be delays, how we are not over-ambitious when we want things to change, and we spend some additional time in working out what those barriers or issues could be and how we could help to resolve them, and to be able to provide people with the best support that we possibly could in making the changes that we needed. In terms of what else didn't quite work, we really struggled with some of the methods of evaluation, because we needed data collected from different points in the pathway, from the GP through to the triage and treat practitioners, and then onwards through the pathway, and collecting that kind of information in a way that is efficient and effective, and means the clinicians are not spending more of their time doing the technical stuff and actually really using their time working with patients, is really one of the key issues. We did come up with some solutions, but that took longer than we expected it to. And I think obviously we were starting from scratch, so we had to really design all of the methods of working, even if it was the communication engagement plan, the work we did through Twitter and other social media. That all took time to plan and think through and work on, and therefore it did extend the length of time we expected the project would take. Those things now having been done, we've captured those, and they're all now available for anybody who wants to do this in future. So hopefully some of the timing issue will be addressed from our perspective. The jury's still out on whether this has fully delivered on what we hoped. We think it's delivered a lot, as I've already explained, but the real test is going to be sustained better clinical outcomes and a reduce in that chronic debilitating care, and indeed more people returning to work or staying in work and being productive for longer through their life. And our longer term evaluation will begin to help us to see that that's what we've achieved. So what's the feedback been like so far? Well, we've had feedback from all of the clinicians who've been working on the pathways and through the project work. The physiotherapy, our therapy colleagues are absolutely delighted with the pathway. It allows them to work at the level that they know that they can, and we know that they can, and they can see the real benefit for the patients that they're working with. They're applying interventions, they're doing work that really makes a difference to the people that they see in front of them. So we've had some really good feedback from them. We've had some good feedback from many of our other clinicians, whether it be consultants or GPs, despite the fact that some might have struggled at times with working in slightly a different way. They can see the benefit for the patients. They know that the patient's getting the treatment. And to be honest, for a GP with this type of condition, it is the one that means that patients keep coming back. With implementing a pathway of this nature and getting someone to the right care at the right time means that revolving door can stop, and we can see real progress in the patient's health. So our clinicians have been really, really pleased with that as well. So far we've been doing some evaluation on patients' views, so that's still to report. But we had, through some of the pilot work and throughout the period, received some really positive feedback from our patients that the care has made a big difference. They are absolutely content with that. It is much better than many, many tests, than doing treatment that actually has not worked in the past. And what we've really come to recognise actually is that not only is this helpful for acute back pain, but actually this is informing now our chronic pain pathway, because many of our patients will continue to keep coming back, and this kind of care is having a real impact on them as well, so we'll be extending the project. So some really good feedback probably from all quarters. So what will I personally take away from this project? Well, I have to say, it's been tough at times, but I think with anything that's worth doing, it's worth putting in the effort, and the results, when you see both improvements in patient pathways, improvements in outcomes for people, is absolutely worth it. So for me, that's one of the things. It's a great change. We've implemented it in the 2 CCGs that I'm personally responsible for, and we are introducing that in many others now across the North East, and that gives you a great sense of satisfaction that that's actually happened. The other thing is, I think to see the commitment of some of the programme team to the work that we've done has been just absolutely fantastic. People with a real vision about we need to improve patient care. We're going to try our hardest to do it, whether that's people in the university, whether it's people from the providers sector, or whoever's been helping us in our project. It's just been fantastic to look at that enthusiasm, and that people have been really committed to making an improvement, for our patients. So that feels to me, being the SRO, being a great thing, because that's helped me to do my job. I guess the other things, the learning that I've had is when you're doing and embarking on a very big and fairly complex project, the importance of preparation, not being too ambitious, making sure that you have got the time, being resourceful, how important it is to actually look at different challenges in different ways, and work with as many friends, colleagues and people who can help as possible to help you achieve when you actually hit barriers. So that's one of the things. So it's been a great project to work with in terms of inspirational people, and making sure that, as I say, that we're all focused on the same thing. So really, I think overall, I've got a good feeling about the project. It's great to see that we've got there. Now the big test is just making sure that we continue and patients continue to receive really good quality services for the future. So if you want to know more about the project, please feel free to hit our website. You'll be able to find links to all of the work that I've been talking about, and find us on social media as well. Very welcome.